Is it sciatica or just back pain? That's what we get asked a lot here at Sundial Clinic here in Brighton. So you might have Googled your symptoms and come away more confused than reassured. And the purpose of this video is to explain all about it so you know what to look for. So back pain is really common. So is sciatica, but they're not the same thing. The important clue is whether the symptoms stay around the back or hip area or travel down the leg. Especially important if it travels below the knee. So this information is not a diagnosis. To get a proper diagnosis, you need to be properly assessed. So bear that in mind as we proceed. So this should give you all the information you need to know what next steps to take. So what do people mean by sciatica? Well, sciatica is often loosely used to mean any pain in the leg, but it's not a precise diagnosis in itself. It's really, true sciatica is symptoms caused by irritation or compression of the sciatic nerve or the nerve roots that contribute to it. The sciatic nerve starts in the lower back and travels through the buttock down the back of the leg. Now, in this model here, you can see the nerve roots coming out of the back, and that these nerve roots coalesce to form a sciatic nerve, which is about as thick as your thumb, and it comes out of the back through the buttock and down the back of the leg. So sciatica is best thought of as a pattern of symptoms, and it can mean that sharp electric type pain, but also tingling or numbness, and sometimes weakness throughout the entire length of the sciatic nerve. Sciatica can also cause burning pain in the buttock or thigh, and as I said, it can also go below the knee, and that's a key differentiating feature of sciatica. So there are some other causes of pain in the back and buttock, and it can be that the joints of the spine can seize up, and in that sort of situation they can become inflamed, and that can cause a so-called referred pain into the back or buttock, and sometimes even as far as the knee, but crucially very rarely below it. So what about a slipped disc? You've probably heard of that if you've been looking around. It's a common phrase, but discs don't actually slip out of place. But a clinician will usually call it a herniated or prolapse disc, which is more accurate. So the discs sit between the vertebra here, and they act as shock absorbers of the spine. Now, the outer ring of the disc can weaken or tear, and then the soft jelly inside can bulge out, as you can see here. And it's that bulging out that causes nerve root irritation, either from direct compression, pressing on the nerve, or chemical irritation, as the jelly itself can create an inflammatory response if it comes out of the disc. So it sounds quite dramatic and it can be pretty painful, but it's usually not serious in that it usually does get better by itself over time. So there are some other causes of pressure on the sciatic nerve, and it can be spinal stenosis, where the holes in the spine get narrowed, and that can be due to degenerative changes as we get older, so-called osteoarthritis. It can also be caused by some squishing of the discs as they dry up. They can spread a little bit. You can get irritation around the hip or buttock muscles, and that can also cause these sorts of pains into the leg. And there are other less common medical issues, but that's why an assessment really matters. So will a slipped disc heal? Well, fortunately, most cases of slipped disc do improve without surgery. The body can reduce the inflammation and resorb some of the herniated disc material, and that can lead to an improvement. But that usually takes weeks or even months to happen. But that's where our care can support recovery by helping to ease the pain, by helping to take the pressure off the disc, suck that disc material back inside and improve the spinal movement, reducing muscle spasm, and that speeds up recovery. The research shows that spinal manipulation, mobilization and exercises speed up that sort of recovery that turns months into weeks, or even in relatively minor cases, days. So when is back pain or sciatica serious? Well, some of the pressure on the spine can cause quite serious nerve compression of the spinal cord, and that would lead to things like loss of bowel or bladder control, any numbness around the groin area, the so-called saddle area or inner thighs. It can also cause numbness or weakness in both legs, and it can be quite severe and rapidly get worse. In such circumstances, it's really important to get to A&E because you need an operation quite quickly. And it's quite rare, only about 200 cases in the UK every year, but it's important to get the right sort of care. So when should you really consider a professional assessment? Well, if you've got leg pain, tingling, numbness, going on for more than 2 or 3 weeks, if symptoms are worsening rather than improving, especially if they're disturbing sleep or worse with walking, or if you're having trouble going to work, and especially if you've got weakness in the leg or foot, then it's worth getting an assessment. But also, if you find that you're getting these problems periodically and they keep on coming back, then it's worth getting an assessment. So you don't need to wait till things are unbearable. If symptoms are hanging about, then it's worth getting a checkup with one of our chiropractors here in Brighton, and that can make a big, big difference to understanding the exact nature of the problem, but also getting you on the road to recovery. So what about some useful self-help advice? Well, avoid complete bed rest. Stay gently active. That's important because otherwise the muscles can waste away and the pain can get worse. Short walks can help, changing positions regularly. Avoid periods of sitting, long periods of sitting on a sofa, especially a soft chair, sofa kind of thing. And you can try heat or ice. Sometimes it doesn't really matter which, but find out which is comfortable, a hot water bottle or an ice pack, or sometimes alternating can make a difference. But especially avoid heavy lifting and avoid bending as well, especially bending and lifting. And don't push through severe pain. So staying active doesn't mean that you're damaging it further, even if you're getting some mild discomfort, but you don't want to cause really severe pain. That's usually too much. So if you do decide to have an assessment here at Sundial, if you're local to Brighton, then we offer chiropractic, physiotherapy, exercise rehabilitation as part of the package of care. And we use the sort of approach that's evidence-based that NICE recommend for this sort of thing. So as a chiropractor myself, we assess and manage muscle and joint problems, and we provide manual therapy and spinal manipulation, as well as disc decompression procedures, which can really work well. And although not suitable in every case, it's quite easy to determine whether you're likely to respond. So do you need surgery? Well, that's another common question. Most people don't actually. Only if it's severe or progressive, or you're getting really significant and deteriorating nerve entrapment, that is a case that you might need surgery. And then obviously it's to your GP for referral to a neurologist or orthopedic consultant to assess you. Also, do you need an MRI? Well, most cases, no, you don't. Most cases, it's fairly easy to determine what's going on without an MRI, just from the history and the clinical findings. And you might need an MRI if you're heading for surgery, if things aren't improving, but that's not common unless, as I've mentioned before, it's getting worse or just simply not improving over many months. And that's consistent with NICE guidelines. So getting back to normal, it often requires the right sort of exercises. We would prescribe exactly the right things that you need to do to strengthen core muscles and strengthen back muscles, as well as keeping you active. Those sorts of things can be really helpful. And if you've got back pain or sciatica and you wonder which is which and whether you have true nerve entrapment, then do feel free to pop in for an assessment and we'll give you a really clear idea about what's going on for you. You can book online or you can give us a call.